Hello everyone, I'm Douglas Hartman. I'm 56 years old, and 2 days ago I just went through an L4, L5 laminectomy, discectomy at Walter Reed in Bethesda, Maryland. A little bit about my story is, first of all, I'm doing this because I found the videos that have been posted online to be incredibly helpful, and so this is my contribution back. I also found most of the videos to be from younger people, 20, 30, and so I didn't see any from the 50-year-old group, and so I thought I'd just post something so that age demographic would be represented. I was an athlete, triathlete, very extensively for the last 6 or 7 years. I don't know if that's what caused the injury. The first time I recognized that I had the injury was mid-January. I just completed the Disney Marathon down in Orlando, Florida. The race was great. It was one of my better races. I felt no pain during the race at all the entire time, and went through the finish line. Everything was wonderful. Got my bags, and then I waited for a couple friends who were basically jogging the course. And so the wait was, I don't know, an hour or two, but it was standard, and we were just standing around. I was getting a little cold, so I just put on a jacket, but I didn't move much. When my friends finished the race, they found us in the waiting area, and I bent over to grab my little backpack that had a few clothes in it. It wasn't very heavy. It was just clothes. It couldn't have been more than 10 pounds. And at that point, I felt this excruciating pain. It was like someone had just cut my back across right across where the belt is, and I couldn't get up. I literally fell, and I tried to stretch it. The pain wouldn't go away. I just can't describe how debilitating the pain was. I was at that time in the finish area of the Disney Marathon, close to the massage area, so I'd never done this before, so I paid to have a massage. It actually made it hurt a lot worse. The therapist was trying, but nothing was really working, and the more she moved my legs and tried to help it, the more it hurt. So I had some Motrin that I always take with me from a previous injury. I took Motrin to get me home to Virginia, and then about a week went by and the pain never went away. I had to keep it fairly medicated, and went to my regular doctor. Then that was determined to be muscle spasms, because I didn't have any of the tingling going down my leg. So I guess based solely on that, it was considered a muscle spasm. So I got a lot more like the painkillers, and several weeks again went by. So we're back into February, March time frame. I went to a chiropractor. I did a series with them, which I'd never done before. It provided a little temporary help, like 24 hours. They would not give me any of the stretches because they were kind of uncertain about where my injury was. They had taken 3 or 4 x-rays, and to them, they just thought they could, through normal decompression, get rid of the bulging disc. But they were really kind of coy on sharing the information with me. So I didn't find that experience to be really transparent and sincere, I guess. But they did show me. They started the process for me to investigate further as to why things were happening. So I thank them for that. Started studying about all this, and then I went back to my regular doctor and was armed with a lot more information, and basically insisted on having an MRI. So I was sent to get an MRI in the July time frame, I guess. So now we're 7 months with all this pain. I got the MRI and was immediately referred to Walter Reed to get surgery. The MRI actually showed 3 bulges, 2 of which would probably go back to their normal with proper care. So there were slight 2 bulges and 1 herniation is how they referred it, and the herniation was beyond the point that it could naturally come back, so it needed surgery. When I got to see Dr. Falis, who was incredible. He he basically described the surgery to me. He was going to do a laminectomy because the penetration or the herniation was so great that he would need to go through the bone to kind of separate, create an opening to do the rest of the surgery on the disc. I was very scared going into the surgery. I'd never been under anesthesia since I was a kid, and when you're a kid, everything's easy. So that was kind of hard, and plus I had to wait. The operation before me and for Dr. Falis had gone over, so I had 2 additional hours to wait. Once I got into the surgery, they gave me the anesthesia, and I went out, and I woke up about 2 hours later in the post-op room, and felt great actually. They walked me around, and all of the pain going down my leg was gone. I had total sensation on my skin, the top of my skin, which I guess some people don't have immediately. And actually, I felt like at that time I could really run. It felt so good. They kept me over that night. Had medication every 2 hours. They came and checked on me, my vital signs every 2 hours, which I guess is not normal for my surgery. They can release you that same day, but given the traffic jams in Washington, I didn't want to, and the fact that my surgery was out at around 4 o'clock, I didn't want to sit in a traffic jam or sit in a car for 2 to 3 hours on the famous DC Beltway. So they kept me over, which was good, and they released me the next day, and I've already gotten a call from Dr. Falis, so it's 2 days later, checking up on me. So that's really my story. I guess in hindsight, if I had to do it all over again, I would say give me an MRI from the very beginning. That was the only thing that really determines the non-bone indications of whether you have herniated disc or you need this type of surgery. Would I have the surgery again? Yes. So now it's actually pretty sore today. But I understand from day 2 and day 3, the pain will be coming back. They gave me Percocet, several other painkillers, which I'm going to try to moderate, not take them all at once, obviously. The only other problem I'm having post-op is constipation. So they gave me some problems with that, and so even though I'm eating a lot of fiber, it's just the whole thing that you can't really push without pushing into your injury. So I'm working on that. I don't know for long term what they're going to do. My instructions are to stay, to walk as much as possible. Absolutely no limits on the walk. To stay mobile, and if I didn't have such a mobile life, they were going to give me the compression socks to wear full time for like 4 weeks, which would have been really kind of uncomfortable. I did have to wear them the first day though. And they were the full ones, like a nylon go all the way up to your groin. So after that, I will go, so no bending, lifting, or twisting for 4 weeks. No driving for 2 weeks, mainly because of the narcotics and the twisting of the neck to look to your left and right, see if cars are behind you. I do have a sore throat because of the tube going down your throat for the asphyxiation. I guess that's really common. So coughed a little bit, but that's all going away. I will be able to run lightly after 4 weeks, and they're encouraging swimming is good, but not till 4 weeks because of the pressure on the core muscles, and also because you have an open wound. But beyond that, I'm really happy that I did it. It did work. It was really scary in a lot of ways, but it's really nice to have the pain over. It basically, if you're an athlete and you have goals like races that you set up for the year, all those have kind of gone by the wayside. And I don't know if I'll be able to do like a full marathon again ever, but this is better. And biking, I'll do biking, although I'll probably at least initially not do a tri-bike where you're bent over, a triathlon bike or a time trial bike. And probably just do a regular bike so you sit up a little more and put less pressure on your back. So that's my story. Hopefully this gives you some contribution. Again, I think it was a positive story and wish I'd done it earlier. Thanks a lot.